I want to introduce a keynote speaker, Dr. Camara Jones, MD, MPH, PhD, currently president of the American Public Health Association. She's a graduate of Wesley College, graduate of Stanford Medical School, where she got an MD degree, then went on to Johns Hopkins, got a PhD and a degree in public health and epidemiology. And after all that great achievement, was assistant professor in public health at Harvard, migrated down to CDC, and now she is considered the preeminent voice addressing racism as a threat to health and well-being in our nation. She is the research director in the Division of Adult and Community Health, National Center for Chronic Disease and Prevention and Health Promotion. A family physician, she is an epidemiologist and educator. She's written many articles, given many lectures, but the one she's going to be talking about today is called Levels of Racism, a theoretical framework and a gardener's tale. Dr. Jones.
Good evening. And what a wonderful assemblage. I am so happy to be here, not because I needed another place to speak, but because this is a group of people who are going to be about action. I already understand that from the day that I've spent here in San Diego. So what I want to do is to equip us with tools so that we can join in a national campaign against racism. I have about 30 minutes in which I'm going to share with you frameworks and definitions so that when you say the word racism, people don't fall out, right? Or get scared or say, take that chip off your shoulder or whatever it is, how people react. So this is difficult. I'm actually going to turn like this so that I can see the screen as well as talk to you. First thing I'm going to share with you is why would I, as a physician, epidemiologist, be talking about racism at all? And why, when we are talking about health and health outcomes, would racism even come into the picture? So the first framework that I'm going to share with you is going to be to help describe levels of health intervention to understand where racism comes into the picture. So here we go. Whoops! Boom! Somebody just fell off of the cliff of good health. And if that were you, or if that were somebody in your family, you would be delighted to find an ambulance there at the bottom of the cliff to speed you on to care. But if we were concerned about other people who might come along that cliff, if we were concerned about population health or community health or public health, we might well ask ourselves, what can we put in place as a health intervention besides just stationing lots of ambulances at the bottom of the cliff? So somebody in this room is going to say, I know, let's put a net halfway down, right? Because that way we can catch people after they've fallen, but before they get crunched up at the bottom. And that's a great idea. But as great as that idea is, nets, they have holes in them. So some people might fall through the cracks, but we could even make that a trampoline halfway down. No holes in a trampoline, right? But even if we have a trampoline halfway down that cliff, we might find ourselves with lots of people just bouncing up and down at half functionality, not able to get back to the top of the cliff. So what else can we put in place as a health intervention? Well, clearly we do need to be thinking about a fence to keep people from falling in the first place. But that's going to have to be a very, very strong fence if there's a lot of population pressure against it. So what else can we do as a health intervention? We can move the population away from the edge of the cliff. So I am going to label these interventions that I've described so far, where the ambulance at the bottom of the cliff, this is medical care. This is what in public health world we call tertiary prevention, which is the level of prevention where you're preventing complications from disease that's already manifest, preventing the amputations from diabetes and the like. The net, or trampoline halfway down, these are our safety net programs, and secondary prevention, which is about early detection, screening programs, prostate screening, mammograms, and the like. The fence represents primary prevention, keeping bad things from happening in the first place, and moving the population away from the edge of the cliff is about addressing what some people are now calling the social determinants of health. These are the things that cause ill health that are outside of the individual. They're beyond our genes, and they're even beyond our individual behaviors. So these are things like poverty or wealth, whether or not you live in a safe neighborhood. Are there grocery stores where you can get healthy food and fresh fruits and vegetables? Are there even streetlights? Is it safe to walk in your neighborhood? Are the playgrounds and parks, is that where the children can commune with nature and frolic and play, or is that where the drugs are being sold and the like? So this is a nice diagram for us to have a community conversation about how much of our resources should be going into ambulances versus nets versus fences versus moving the population. If we were thinking about infant mortality, we might say, how many neonatal intensive care units do we need versus prenatal care, the screening, versus WIC programs, versus excellent educational opportunities for our young girls so they don't have babies so soon. But as useful as this diagram might be for even marching down to the State House, so far there's a fatal flaw in it in that it does not yet address how health disparities arise. So I want you to keep this cliff in the back of your mind. We're going to talk about how health disparities arise on 3 levels, and then we'll come back to the cliff. So very quickly, how do health disparities arise? Well, especially when you're talking about racial, ethnic health disparities, we unfortunately have lots of evidence about differences in the quality of care received, even if you're in the same healthcare system, by race or by ethnicity. So the Institute of Medicine in 2002 released its unequal treatment report that pulled together evidence really from hundreds of studies documenting that it mattered whether you were black or white when you had chest pain, because the vigorousness with which your symptoms would be addressed depended on your race, even if everybody's in the same VA system. It mattered if you were Hispanic or white when you walked into an emergency department with a long bone fracture in terms of how much pain medication you would get. And all of those studies were surprising, but even that IOM panel said it's not just what happens within the healthcare system, it's not just differences in quality of care, because some people can't even get into the system in the first place. So there's a second level at which health disparities arise, that's differences in access to care. But you know, we all need to realize that health is not created within the healthcare system, and there's a huge third level at which health disparities arise, which are the differences in the quality of our lives, the differences in our life opportunities, exposures, and stresses, which are making some individuals and communities sicker than others. And when you think about these 3 levels at which health disparities arise, differences in quality of care, differences in access to care, and differences in underlying exposures and opportunities, it's really like a huge pyramid, or better yet, like an iceberg, and the huge hidden base are the differences in the quality of our lives. And then those same people who've been made sicker are usually the ones who are frustrated because of limited access to the healthcare system. And then even the lucky ones who get into the healthcare system are sometimes further injured because of differences in quality of care. But now, thinking about these 3 levels at which health disparities arise, let's go back to the cliff. But now we're going to recognize that we're really not dealing with a flat, 2-dimensional cliff, but actually we're dealing with a 3-dimensional cliff. And at some parts of the cliff, there might be an ambulance there, but that ambulance has a flat tire. So it's slow, or it goes off in the wrong direction. Or maybe there's no ambulance there at all, and maybe there's no net nor fence, and usually at those parts of the cliff, the population is being pushed closer to the edge. So now, I'm going to label these observations about our 3-dimensional cliff with how health disparities arise. Where the differences in quality of care, that's when the ambulance is slow or goes off in the wrong direction. The differences in access to care are no ambulance, no net, no fence, and the differences in our underlying exposures and opportunities are represented by the closer proximity of that greeny population to the edge. So now that we recognize that we're dealing with a three-dimensional cliff, there's a whole new set of questions that arise. The first question, of course, is how did the cliff become three-dimensional in the first place? And that's usually because of historical injustices that are being perpetuated by present-day contemporary structural factors. But given that the cliff is three-dimensional, we also need to ask, why are there differences in how resources are distributed along this cliff face? And why are there differences in who's found at different parts of the cliff? And why are the oranges back here in the way and the greenies being pushed closer to the edge? And when you start asking and addressing these kinds of questions, you are now doing something that differs from addressing the social determinants of health. You are now addressing the social determinants of equity. And these social determinants of equity are systems of power that can distribute resources and populations. So they include racism and sexism and heterosexism and economic systems like capitalism and the like. And actually, with this cliff, I have distilled 3 different dimensions of health intervention. When you go back to your junior high or high school geometry, 1 dimension was a line, 2 dimensions was a flat plane, and 3 dimensions was space. Well, on the line at the edge of the cliff is where we can display all of our health services, all of the health care, all of our curative and preventive health services. And if you say the word health in this country, people will complete the thought for you and go immediately to health services, health care. I had that experience this morning on a radio interview. I'm trying to talk about health writ large, and the conversation kept going back to the healthcare system. Now, this is actually where a lot of our national conversation about the Affordable Care Act has been, right? And we want universal access to high-quality health care, but not because that in and of itself is going to give us large and sustained improvements in health outcomes or eliminate health disparities. We want universal access to high-quality health care because that is how a civilized society values all of its people equally. But we have to recognize, as wonderful as the healthcare system is, we can overwhelm any system if everybody's crowded up against the edge of that fence, right? So we have to move into the second dimension, which we can display in a plane, and we have to be talking about addressing the social determinants of health, moving the population away from the edge of the cliff by addressing poverty and adverse neighborhood conditions and unequal and bad educational opportunities and jobs and all of that. We must address the social determinants of health if we're going to have large and sustained improvements in health outcome. But if we do that without recognizing that we're actually dealing with a three-dimensional cliff, we could move some of the population away from the edge of the cliff, but not all of the population, and we could actually make health disparities worse. So we also must address the three-dimensionality of the cliff and address the social determinants of equity, these systems of power that include racism, sexism, heterosexism, capitalism, and the like, if we're going to achieve social justice and eliminate health disparities. So I often use this cliff actually to introduce the word racism to an audience, because some audiences aren't coming in expecting to hear about racism, right? And I joke and I say, well, I've said the word racism about 4 or 5 times now and nobody fell off their chair, so let's go. But it's also an important model for us to understand that even if we are working in the healthcare sector, even if I'm a physician trying to be the best ambulance driver that I can be, I need to recognize all of these other levels that are actually backing me up. And even though my day job might be as an ambulance driver, as a citizen, I need to be all about addressing the social determinants of health and the social determinants of equity. If we do not address all of this, we will not have progress in terms of eliminating health disparities or achieving health equity. So, what is racism? Now we're going to focus straight on what we've been convened here to talk about. When I say the word racism, I am clear that I'm talking about a system. I am not talking about an individual character flaw. I am not talking about a personal moral failing. I'm not even talking about a psychiatric illness, as some people have suggested. But I am talking about a system of power. And it's a system of doing what? It's a system of structuring opportunity and of assigning value. And on what basis is the opportunity structured? And on what basis is the value assigned? It's based on the social interpretation of how we look, which is what we call race. And so Dr. Hood already alluded to that in some regard, but just look at me. So I know in Atlanta, where I live now, if you looked at me, I would be clearly black in Atlanta. Don't know what I am here actually in San Diego. Do know that black. Okay, thank you, thank you, thank you, thank you. But guess what? In some parts of Brazil, you look at me and I'd be just as clearly white. If you were to look at me in South Africa, I would be clearly colored. So here I am with the same physical appearance, but the social interpretation of my physical appearance in these three settings would assign me to three different racial groups. And furthermore, if I were to stay in any of those settings long enough, then my health outcome would become that of the group to which I've been assigned, even though I'd have the same genes in all three places, right? And for all of us, you know, we think when we grow up in this country that the racial categories that we see are just so natural. But they are not. People coming from outside the US have to learn our racial categorization system. So I have described racism as a system of structuring opportunity and assigning value based on so-called race. Well, what are the impacts of this system? Well, when we do talk about racism at all in this country, we go to understanding that it unfairly disadvantages some individuals and communities. But it doesn't take very long to recognize that every unfair disadvantage has its reciprocal unfair advantage, so that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about. It's hard, but I'm actually going to give you some tools tonight for us to be talking about that too. But even as we say, okay, I understand that this system is either unfairly disadvantaging or unfairly advantaging individuals and communities, racism is also sapping the strength of our whole society through the waste of human resources. And there are many, many, many examples of this, but I'm just going to give you two. The first of all is how we as a nation still are not vigorously investing in the full, excellent public education of all of our kids, because the blinders of racism make some of us believe that there is no genius in the barrios or in the ghettos or on the reservations. We can get along very well, thank you, without those kids. But of course, we know that there's genius in all of our communities. And if we were to fully invest in that genius, we could be doing so much better as a nation, even as a world. I often say that we would already be up on Mars farming, if that were a good idea, if we were to invest in all of that genius, right? And another example about how racism saps the strength of all of us is how these same blinders have made us as a nation what I describe as complacent with the wholesale warehousing disproportionately of so many of our black and brown men in the prison system, as if that did not separate us from human potential. And if you know anybody who's either stuck in the prisons or cycling in and out, coming out, can't vote in most states, can't get a job, can't get public housing, no other options, going back in, you know that there are many geniuses caught up in this system that if there had only been some other way, or we could create a way now if we had the will, then you have to understand the profundity of that loss. And actually, when I look at the impacts of racism, the unfair disadvantage and its reciprocal unfair advantage, as important as it is for us to talk about those things, perhaps the most important bullet is how racism is sapping the strength of the whole society. If we can make our conversations in the media about that, if we can do data collection about how racism is sapping the strength of the whole society, if we can have conversations around our dinner tables about that, we might have more people engaged in dismantling this system and putting in its place a system in which all people can know and develop to their full potential. So, how could racism impact health? Because this is a very nice definition for understanding that it's a system, that there's this, you know, the two sides of one coin, disadvantage and advantage, and that it's sapping the strength of the whole society. But how can racism turn into asthma or obesity or differences in infant mortality or cancer prevalence? And to understand that, I find it useful to think about racism on three levels: institutionalized, personally mediated, and internalized. So I am going to define each of these levels, give you examples of how they can impact health, and then illustrate them with the second story that I'm going to share with you, my Gardener's Tale allegory. So, institutionalized racism, that is the system. That is the structures and policies and practices, norms and values that results in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator. This is the kind of racism that often shows up as inherited disadvantage, or its reciprocal inherited advantage. And it shows up, it's been institutionalized in our laws and in our customs, in our background norms. We see it in terms of material conditions and in terms of access to power. So examples include differential access to quality housing or equal educational opportunities, or equal employment opportunities, or even the same level of income at the same level of employment. Differential access to medical facilities, including linguistic access. Differential access to a clean environment, and the whole disproportionate placement of toxic dump sites or bus transfer stations in communities of color. And then in terms of power, differential access to power as information. That could be health information, or it could even be information about our own histories. Differential access to power as resources, not just money type of resources, but social networking, knowing somebody on the board. And differential access to power as voice in media, in government, and the like. Now, sometimes when I share this slide, I get stopped right about here, and somebody will say, well, look, Dr. Jones, at that top bullet of examples: housing, education, employment, income. Dr. Jones, isn't that really what we call social class? So why do you have that on a slide about racism? Are you talking about racism, or are you really, really, really talking about social class? And that's an important question. Many of you in this room are saying, okay, so what's she going to say about that, right? So let me answer that question. And the first part of my answer starts with the observation that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. For each marginalized or stigmatized or oppressed group of color, there has been some initial historical insult. So for American Indians, it started with the taking of the land and the near genocide, and then the moving of the survivors to the reserved lands, the reservations. And then if something good was found under one reservation, oops, got to pick them up and move them somewhere else, right? For people who have for centuries been living in a part of the world that was Mexico, when Mexico became New Mexico and California and Arizona, right? And their children are still being harassed today. For people of African descent, it started with the kidnapping of West African people, and then our importation across the Atlantic with tremendous loss of life in the Middle Passage. And then for the survivors and their children and their children and their progeny, on and on for centuries, the coerced usury of our unpaid labor for centuries to build this country. But then some people stop me there and they say, oh, Dr. Jones, there you are, you're talking about slavery. That was an unfortunate chapter in our nation's history. Yeah, they say, but they say, Dr. Jones, don't you recognize that the enslaved people were emancipated in 1865? And it is now 2015. So that is 150 years ago. So Dr. Jones, all else being equal, don't you think the impacts of slavery would have washed out by now? But the key phrase there is all else being equal, and all else has not been equal since 1865, and all else still is not equal today. And there are what I describe as contemporary, present-day structural factors that are perpetuating each of these initial historical insults. So when people ask me, am I talking about racism or am I really talking about social class, I say that institutionalized racism explains why we even see an association between social class and race in this country. This is a huge revelation, right? It doesn't mean, it is important for us to eradicate poverty. And I would go further. I would eliminate the income inequality that we see in our nation. If you gave me a magic wand today to eliminate income inequality, boom, 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 done. But if I did that without addressing the background structures, policies, practices, norms, and values that were deliberately put in place to shunt different populations into different possibilities. Even if I equalize things today within one generation, within 20 years, you would start to see a stratification by race again in terms of social class. So this is all to say it is important to address poverty, but we must address the mechanisms of institutionalized racism if we're going to have equity. The other thing before I leave this slide is to say that institutionalized racism can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. And very, very often, institutionalized racism shows up as inaction in the face of need. The second level of racism that I'm going to describe, personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. So here we are. This is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the different idea, the prejudice, and then the different action, the discrimination. And many people call this interpersonal racism. I call it personally mediated racism, even though it's a tongue twister, because I am still understanding racism as a system. And this is the system manifesting or operating through people. How could this impact your health? Well, my, police brutality. This is a very old slide. I used to talk about, imagine you were pulled over by the police for driving while black or driving while Latino and then interpreted as resisting arrest and hit upside the head. Now I can just give you a litany of names. Laquan McDonald, Jamar Clark. I mean, Freddie Gray, Michael Brown, Trayvon Martin wasn't even a police officer, a self-appointed neighborhood watchman who thought that that young boy did not belong in that neighborhood and killed him. On to Sandra Bland. And I don't even know the people out here, there are brown people, red people, many people where the police assumed that that cell phone in your hand looked like a gun to me. Or as you walked away from the car with your knife, it looked like you were charging me, right? And so police brutality without accountability in so many instances is clearly a threat, not just to the lives of those who are directly affected, but to the families that love them and for the families that fear for their own children. Physician disrespect, which can be as subtle as a physician not giving a patient the full range of treatment options. Because the physician figures, oh, that patient couldn't afford, or wouldn't understand, or wouldn't comply, or whatever it is they assume. And it also can be quite blatant, like sterilization abuse, which has had many, many iterations in our nation's history. Shopkeeper vigilance, being followed around in stores. Not even asked, may I help you, just followed around, right? Waiter indifference, not getting quick, respectful treatment. And these are just two examples of what many people call everyday racism, or the microaggressions, the little subtle disrespect that's probably related to the fact that many people of color have elevated blood pressures, high blood pressure, hypertension, that doesn't even go down at night. Teacher devaluation, when a teacher looks at a young child and thinks, that child can't learn, and puts them off in the ADD trap, that child will never even know their full potential, much less have the opportunity to develop to their full potential. And like institutionalized racism, personally mediated racism can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. But even more important is to recognize that personally mediated racism can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism that I describe, internalized racism, I define as acceptance by members of the stigmatized races of negative messages about our own abilities and intrinsic worth. Here I am speaking from the point of view of members of the stigmatized races, and I have friends who do anti-racism training who have correctly pointed out to me that there are many white people who are walking around with an internalized sense of entitlement, and they say, isn't that also internalized racism? And I will agree with them. But I'm going to put that over to the side with the institutionalized stuff right now. So now I'm going to speak from the point of view of members of the stigmatized races. How could this impact our health? Well, self-devaluation. Feeling maybe I'm really not as good as. Maybe I shouldn't even try to graduate from high school or apply to that college or try to live in that neighborhood or apply to that job. And it even turns into fratricide, black on black or Latino on Latino crime. Because if you don't value yourself, you won't value others who look just like you, and you just as soon off them as not. So white man's ice is colder syndrome, that phraseology comes from my parents' generation, and what it meant then and what it still means today for many folks is, say you're a person of color, say you're black, and you need a lawyer. You might actually go out of your way to get a white lawyer over a black lawyer. Or if you needed a doctor, you might seek out a white doctor over a black doctor. In fact, if your lemonade was warm, you might go way down the street to get the white man's ice over the black man's ice, deeply believing that the white man's ice was colder, deeply internalizing the myth of white superiority. Resignation, helplessness, hopelessness, all of that turns into self-destructive health behaviors. It turns into not registering to vote. It turns into not voting even if you are registered. And all of this is really about accepting the limitations to our own full humanity of the box into which we've been placed. So that when we hear young high school students of color, one of them's trying to be the valedictorian of the class and others are teasing them and saying, oh, you know, so-and-so's just trying to be white. We need to challenge that. Because since when did white people claim exclusive access to excellence? They did not. They did not. So now I'm going to illustrate these three levels of racism with one of my allegories. I actually have about 25 allegories now on issues of race and racism, because I find that if you can talk through images that people can see, it's easier to have these conversations. Most of my allegories were sparked by something that I saw with my own real eyes. So first I'm going to tell you what I really saw in my life, and then I'm going to make it a story about racism. So when I was, my husband and I, newly married, we moved back to Baltimore for me to finish my PhD. We bought our first freestanding house. And it was a lovely house with a big wraparound porch with flower boxes all on the porch. And so we bought the house in October, weren't really thinking much about those flower boxes, but when spring came, we were all excited, we're going to decorate our house. So we run out getting ready to plant our marigold seeds. And then we saw that some of the boxes had dirt in them, but some of the boxes were empty. So my husband dutifully goes down to the gardening store, and he comes back hauling big old bags of potting soil, right? And we fill up the empty boxes, and then we put equal numbers of marigold seeds in all of the boxes, and we water them. And you know, I am not the gardener in the family, so at this point I sit back, just going to be delighted, right? I had reached my max in terms of gardening. But about 3 weeks later, as I'm walking out of my front door onto my porch, I looked at my flower boxes and I literally stopped in my tracks. Because as I looked at these flower boxes, it looked to me like we had planted completely different species in some of the boxes versus others, because some of the boxes were full of plants and those plants were tall and vigorous, and some of the boxes just had a few plants in them, and they were scrawny and scraggly looking. And then I realized what had happened. You see, that potting soil that my husband had brought turned out to be rich, fertile soil, so that every single seed planted in the rich, fertile soil had sprouted. And the strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that old soil that we had found in some of the boxes turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil had just died. And even the strong seed in the poor, rocky soil had to struggle to make it to a middling height. And so if you guys are gardeners, maybe you've composted half of your garden, right? You've seen this image with your own real eyes. And the image is about the importance of the environment, the importance of the soil, right? But now I'm going to take this image and I'm going to make it a story about racism by introducing a gardener. So now we have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil, and she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms, and the gardener prefers red over pink. So what does she do? She puts the red seed in the rich, fertile soil, the pink seed in the poor, rocky soil, and 3 weeks later she sees in her boxes what I saw in mine. In that rich, fertile soil, all of the red seed has sprouted. The strong red seed has grown very tall and vigorous. The weak red seed is at least halfway up. In the poor, rocky soil, the weak pink seed has died. And here comes a strong pink seed struggling to make it to a middling height. And then in those two flower boxes, those flowers go to seed. And then the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year after year, the same thing happens until About 10 years later, the gardener's looking at her flower boxes and she says, you know, I was right to prefer red over pink. So we're going to interrupt the story for a second there to say the first part of this story is how institutionalized racism works. You had the initial historical insult of the separation of the seed into the two types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and through inaction in the face of need, perpetuation of the inequity. But now we're going to pick the story back up to say, well, okay, well, where is personally mediated racism in the garden? Well, the gardener's looking over at red, loving red, and she looks over at the pink and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil, so she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not understanding or acknowledging that they're benefiting from enriched soil. Pink is looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees. And you know, the bees are just minding their own business, collecting nectar and pollinating. So here comes a bee into one of the pink flowers, and then bzzz, to another pink flower, and bzzz, to this pink flower, and this flower is like, get away from me, bee. Do not bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers and we can say, pink is beautiful, power to the pink. And it is an important intervention. I'm not making light of that. It's an important intervention. But if that's all we do, it's not going to change the situation in which the pink flowers find themselves. So you say, okay, well, let's address the personally mediated racism. Let's have a conversation with the gardener, or better yet, let's have a workplace multicultural workshop for the gardener, and it's all good. So we have our workshop, and in the workshop we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, and maybe she won't. But even if she does, it's still not going to change the situation in which those pink flowers find themselves. I think that if you really want to set things right in the garden, you have to address the institutionalized racism, which means you have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although in my mind it makes it easier for the gardener to continue segregating resources going forward. But if you keep separate boxes, it means you have to enrich that poor rocky soil until it's as rich as the rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. And think about it. They have been selected for survival and strength, right? So they're going to look at least as beautiful as the red. And there, in that intervention on the institutionalized racism, you will have also addressed the internalized racism. Because pink will no longer be looking over at red, thinking red is better, or wanting to be red. And in that intervention, you may also address the personally mediated racism. Now, the original gardener who goes to her grave preferring red over pink would be less, you know, I mean, she's not going to change her mind, but her children who grow up and see the flowers equally beautiful would be less likely to have that kind of attitude. So this story has been to illustrate those three levels of racism and to strongly suggest that if we want to set things right in the garden, we have to at least address the institutionalized racism. Good if we address all the levels at the same time. And by addressing the institutionalized racism, all the other levels may take care of themselves. But there's one more important question that I haven't asked yet, which is, who is the gardener? Oh, thank you. Ponder that for a sec. So who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, or agency. And so often we set up agencies for people instead of letting people have their own agency, and control of resources. And in my mind, these three things are the elements of self-determination. So who is the gardener? Well, this slide used to say, who is the gardener? Government, power to decide, power to act, control of resources. That was until I went to work for the CDC. So I changed my slide. But it doesn't make government any less part of the gardener. But government is not the only part of the gardener, because foundations or media or corporations or even communities, to the extent that they have self-determination, can be part of the gardener. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even including the pink flowers as part of her garden. So our challenge actually is what to do about the gardener. Do we try to make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions that can come out of this. I want to just share two, and then we'll have time for a discussion after all the panelists, because I'm almost done, but not quite. But I just wanted to share two things that I've been asked in previous sessions. I was once asked, Dr. Jones, excuse me, but why should the red flowers share their soil? Now, to me, that was a very revealing question. First of all, it shows the power of this story to start conversations about racism. Because if we were talking about racism between you and me, that question would never even come up. But my answer to that question, why should the red flowers share their soil, is that that soil doesn't belong to the red flowers. It belongs to the garden. Right? But the second question is even maybe more subtle. What if that is not the original gardener? What if that's the gardener's great-great-great-great-grandchild? Here we are, right? And they always have seen the flowers looking like this. They think this is the natural state of affairs. What then? So there are 3 steps there. The first important thing is that we have to make the differences in the height and vigor of the pink and red flowers a problem. We have to talk about eliminating that difference, eliminating those disparities. But the second thing is we have to get a clue about how to do that. And in order to get that clue, we have to make those flower boxes transparent. We must be talking about the differences in the quality of the soil. But the third and more subtle point to be taken out of this question is we also need to make it clear that the pink seed didn't just jump over into that poor rocky soil. So we have to talk about the importance of history, the gardener's agency in all of this. And in fact, you know, this story used to always be about the quality of the soil until a few years ago when I recognized that we also must address the gardener's initial preference for red over pink, which set up the whole thing. That's what some people call cultural racism or, you know, white supremacist ideology. We must address that because even if we were to equalize the soil today, if the gardener continued to prefer red over pink, the gardener would find other ways to advantage red over pink. So I am going to close with just 3 other very quick images. That Gardener's Tale, you could actually find that published. It's a 4-page paper, 2 pages front and back. If you Google Camara Jones Gardener's Tale, you can get to that, right? These last 3 allegories I haven't yet published. They're just quick images. Maybe they aren't as polished as the Gardener's Tale, but I want you to listen carefully because I think you can share these with somebody tonight, somebody that you live with, a coworker or whatever. The first of these, Japanese Lanterns, Color Perceptions, was sparked by my experience as a medical student, having been invited to a faculty member's garden party just up the way in Stanford. And it was a lovely party, and I felt all grown up, and the garden was festooned with colored light bulbs and Japanese lanterns and lots of food. And as night fell, you know, I got a little bit weary of the conversation and all, and I thought, well, let me just sit on the edge of the garden and let the music and the conversation wash over me. So as I sat there, I became fascinated by a group of pink moths. And it was almost like a Zen experience. I was like, you know. And then my gaze shifted. And I noticed, oh, look at the green moths over there and the blue moths over there. And isn't it interesting how they sort according to their kind? Now, that was just a quick momentary thought, but it was a thought that I had. But you're looking at me crazy, like, did I really think that the moths were sorting according to the kind? And you realize that if I had been in another part of the garden, I might have been talking about yellow and purple and orange moths. And because you have seen moths under a universal light, you recognize there's no such thing as pink or purple or blue or yellow, green, or orange moths, that moths are different colors, but they're different colors of tan and brown and speckled and splotched. And the revelation here was that the colors that I thought I saw and the colors that we think we see are actually due to the lights by which we look, where the colored lights distort and mask our own true variability. And this started me to thinking about what is race and how do the racial categories that we construct color our vision of who we are. And so this was just a nice little image about race as a social classification, not a biologic descriptor, about race as the social interpretation of how one looks in a race-conscious society. And if you live in a society that's hanging up white and black and Hispanic and other lights, that is what you're going to see. Go to another part of the world and maybe it's negro, pardo, you know, whatever, that's what you're going to see. Go someplace else. And until we look at each other under a universal light that allows for all possibilities, that will be the only time when we understand our true variability. The second image, Dual Reality, a restaurant saga, was also sparked by my experience as a medical student at Stanford. I was studying late with some friends, and we were hungry, and there was no food in the apartment, so we decided we're going to go into Palo Alto and find something to eat. So we go and we find a restaurant, and we walk in the restaurant, and we sit down, and we order our food, and the food is delivered, and we're eating. Here we are. And that's not a very remarkable story at all. Most of us have had an experience like that. But as I'm sitting there, I looked up and I noticed a sign, and the sign was a profound revelation to me about racism. And you're like, ooh, in Palo Alto? Right? What did the sign say? Sign said open. Well, you know, because here I am, I'm sitting at the table of opportunity eating, I glance up, I see a sign that said open. If I hadn't known about the two-sided nature of that sign, and the fact that indeed now, because of the hour, the restaurant was now closed, I would have just assumed that anybody hungry on the street a few feet away from me, but on the other side of that sign, could come on and sit down and eat. But because I knew something about the two-sided nature of those kinds of signs, I recognized that the restaurant was closed because of the hour, and then I understood how racism structures two-sided signs in our society. I recognized that racism structures a dual reality, and that for those who are sitting inside the restaurant eating, and they look up and they see a sign that says open, they do not even know that there is a two-sided sign going on. Because it is difficult for anyone to recognize a system of inequity that privileges us. It is difficult for men to recognize male privilege and sexism. It is difficult for white people in this country to recognize white privilege and racism. It is difficult for all Americans to recognize our American privilege in the global context, except we got a little hint of that with Ebola, did we not? Yet for those on the outside, they're very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So for those on the inside who say, is there really a two-sided sign? Does racism really exist? I acknowledge that it's hard to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing, it's an empowering thing. And if you care anything about the people on the other side of that sign, then maybe you'll talk to the restaurant owner and say, they're hungry, because you're right there with them, right? It's on the same side with you. And you say, there are hungry people out there, why don't you open the restaurant? Let them come in, you'll make more money, and oh, the conversations we can have. Or maybe you'll pass food out the door, or maybe you'll help break down the glass or tear down the sign, but at least you won't be sitting there saying, I wonder why they don't just come on in and sit down and eat, because you'll understand something about the two-sided sign. Thank you. Wow, thank you. Wow. And the last story is actually not based on my own real experience. It's based on an image from the book, Why Are All the Black Kids Sitting Together in the Cafeteria and Other Conversations About Race, by Dr. Beverly Daniel Tatum, who just retired as president of Spelman College. So she has an image in her book. I'll tell you her image, but then what I do is I expand on that image to talk about being actively anti-racist. So I actually, is there a lavalier mic or any mic I can carry, or I can just shout? I know we're taping. Okay, so in her book, she describes racism as basically kind of living your life on a conveyor belt. We're going to go over here. So she says racism, people are just going to school, going to work, raising their families, living their life on a conveyor belt that's inexorably moving through racism, toward racism. If they just looked up, there's a big sign there, right? So I'm going to take her image about this conveyor belt, and I'm going to make it a story about how to be actively anti-racist. So I'm going to put it on this conveyor belt. Here we are. And we're just living our lives. And you know, most people, racism is a passive thing. Ooh, racism is a passive thing for most people. So they're not trying to be racist, but they're moving through racism and toward racism inexorably. And actually, many people benefit from this movement. So racism is most often passive. And most of the time, I'm just that down. So most of the time, people don't even look up to see where they're going. And sometimes people might look up and they see racism, and then they close their eyes and they just stay on the conveyor belt because they're in denial. Thank you.
So people might look up, but they're in denial, right? So they close their eyes. Or maybe somebody looks up and they see racism and they turn around, but they don't do anything else. They're still on the same conveyor belt, right? So maybe they're colorblind. But the question for us is, here we are tonight. Many of us came in here knowing that racism was there. Others were just like, oh, it really is there, right? So we see racism. What are we to do? So I challenge us, as we are on this conveyor belt, we see racism, we have to at least turn around, but now we have to start doing something active. We have to start walking at least as fast as the conveyor belt is moving just to stay in the same place. But what happens when you're walking backwards on a crowded conveyor belt? You keep bumping into people, right? And they say, hey, watch out, buddy, where are you going? What are you doing? So this is your opportunity to do the first of 3 stages of being actively anti-racist, which is to name racism, to say, do you see where we're going? Do you want to go there, or will you turn around and walk with me? Now, most people will say, just get out of my way, because they do not want to be disturbed out of their comfort. But maybe 1 or 2 will walk with you. So now you're 2 and 3 people walking backwards, and you keep bumping people, and you keep naming racism, and you get more and more. You'll never get 50%, but you get more and more. So now you have like a little critical mass. So now you can walk a little bit faster against the tide, right? On this conveyor belt, you keep picking up more people, and where are you going? You're not just going away from racism, but actually you are headed to the motor that runs this conveyor belt, right? So now you're at the motor, and the second task is to ask, how is racism operating here? And this is where you look at structures, the who, what, when, and where of decision making. Policies, the written how of decision making. Practices and norms, the unwritten how of decision making. And values, the why. You say, how is racism operating here? And I think I see it. It's this lever. So I pull up on the lever, and the system starts stuttering because the lever is part of it. But you know, it's a very fancy system. So it reconfigures itself, which is the importance of the 3rd stage of being actively anti-racist, which is to organize and strategize to act. So as I'm pulling up on this lever, I need you to push the button. And I need you to pull on that pulley. And I need you to spin the dial. And I need you to, whatever piece you can find, because all of us together can dismantle this system and put in its place a system in which all people can know and develop to their full potentials. So, and that is our challenge. And actually, I want to tell you, you heard in the introduction that I am the president of the American Public Health Association. I am challenging our association and as many other national organizations and communities as want to join us to join in a national campaign against racism. Because I know that racism is not a cloud, it's not a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms. So, just to reiterate these last 3 stories, I told you about Japanese lanterns as race as a social construct, dual reality, the open-close sign, and life on a conveyor belt. I really, really sincerely encourage all of us to become actively anti-racist. I think that the time, if not now, when? If not us, who? We must join together, and I know this is a group prepared for action. So thank you, and I look forward to the other